And part of our vision for Science Sunday every year, since we began this last year, and part of our vision for this year is to get a group of active scientists together and talk about each other's work. And I'll sort of start it off with some questions, but hopefully you guys will be able to mix it up and ask each other about how you work, how you come up with the questions, that sort of thing. Are you interested in what you heard from these folks before I brought you on stage? Yeah, very much so. And what's a question, Dr. Ackerman, that you might have for these two guys here?
Well, congratulations, you guys. I mean, I don't know if I have a question. I'm almost numbed to realize that the 5th grade projects that I did with my kids were which paper airplanes would fly the furthest in the gymnasium. and for the other boy, it was which root beer do they like the best?
Right.
And girls like the sweeter one than the boys, which was Barks. But wow. Well, you guys got a pretty impressive jump start on transformative thinking. So
that's for sure.
I'm impressed.
And for people who are traumatized by what these 11-year-olds are doing, after this session, there'll be a special group for you to talk about that. But are nano transducers able to function in the circulatory system without having an impact on the heart, as far as you understand it, Dr. Ackerman?
Go ahead, Mr. Asirvatham.
He's a cardiologist, so I'd ask him, but go ahead, really. Yeah.
Okay, well, they wouldn't really be doing anything outside. See, they would just stay inside the cell and they wouldn't function and do anything until they reach the neural network. So they can go through the heart harmlessly, just like any other cell. But once they reach the brain, then it'll be clear that they're different than the others.
See, John is totally heart friendly.
Yeah, sounds pretty good. Sounds pretty good. What about mitochondria friendly inside the cell? What are your questions, Dr.
No,
Joyner?
I think there's two interesting things about this. One is if you actually look at what's happening out there, people are coming up with all sorts of wearable and even some embeddable devices, and that's sort of starting to happen with various watches that people have. Some of the medical devices that people like Mike put in the cath lab are starting to be so they can be interrogated or actually send data to various people that would monitor. Big interest in home monitoring. So this isn't as far off as people think. And I think the other really interesting thing about their team is we obviously have the classic mix of somebody who's maybe more interested in the humanities versus somebody who's more interested in what you might describe as hard sciences. And one of the things that happens sometimes in science is people are a bit socially autistic and they don't really think about how these things might be applied in the real world. And you need individuals from the other creative community, which is arts and music, to help people sort of work it out. So I think they have it just right.
I was going to ask you, Joy, how do you think you would design how your system works to enable someone with autism to bring out those qualities of music and the humanities, maybe? How would you design it so that those qualities would be accentuated, do you think?
Well, I haven't really thought about that.
Perfectly okay. But how does your humanities orientation, just thinking about what Dr. Joyner said, how does your arts orientation help this scientific collaboration?
Well...
if this project as we plan, this project will continue, and if this project becomes a reality, she could help the autistic children become more adapted to a normal life and get used to it. It helped them lead normal lives.
So there's a lot of sort of humanity in the actual execution of a program like this. Dr. Hartmann, I noticed that you three scientists really seem to be focused in the genetic realm, and that's, I don't know if that's hot right now in science. These folks are thinking about nanotechnology. Are we seeing a possible passing of the torch that nanotechnology is next, that we're beginning to see the horizon in terms of genetic research?
Whether it's genetic or just using cells or genes to do things in new ways, I would, if I could take a slight sidebar on
Sure.
that, An example would be in the treatment of ovarian cancer, where these cells are generally quite aggressive, but as it turns out, they have expressed certain receptors for the measles virus. And it had been observed decades ago that children who might have had a tumor who got normal infection with measles would have regression of this. So there's something in that virus that can cause cancer cells to die. And the mechanism for that is a little complicated. So people at Mayo, another team, are using the measles virus as cancer treatment. It's actually a slightly modified strain of the measles virus. What's tricky is we've all been immunized against measles virus. So if you try to give it, the antibodies are there to take it. Well, they use stem cells from a woman's fat in her abdominal wall, mesenchymal stem cells in this case, take them out, grow them in the lab until there are a sufficient number, put the virus in those cells, give her her own cells back. It slips through the screen of the immune system and actually homes to the areas where the cancers are. So, you know, a similar idea along that theme of using cells that might be there for a different reason to do a task for you. As far as genetics, I think we are in the genomic age. We are using many genetic clues to approach diseases. I think these last 10 years that we've had genomic data have been incredibly productive.
Do you see, go ahead,
Can
please.
I follow on that, John? Because I think one of the challenges that we have in science is, you mentioned is genomics or omics passe now, and the baton is being handed off to nanotechnology. I think that's one of the problems actually in science, is there's a tendency to chase and follow the hot technology. And what's the current in vogue technology that we should be writing our grants around, exploiting that technology because that's the current wave, rather than stepping back and saying, what are the questions and what are the solutions? And then whatever the questions and the problems are, whatever the solutions are, whether they're nanotechnology with the shoe or whether they're stem cell therapy, we need to go after solutions rather than just kind of doing the grantsmanship of weaving in the hottest, latest, greatest gadget to add to our studies. Because sometimes those gadgets just get us a new grant, but they don't actually advance the ball and get us smarter about the condition. So there's certain conditions, I would say, where the wave of genomics and the excitement of genomics, a lot of it had to have the engine revved up really high 10, 15 years ago to get $3 billion of funding to complete it. So that led with it sort of the hype that the moment we have the Human Genome Project completed, it's going to be aha and game over and all easy. And it turns out that actually the answer is the game has just begun with it. But now it's kind of viewed as, well, we've been there, done that, spent a lot of money on it, we got to move on to something else, and we're now passing up on and saying, well, we don't invest in genomics as much anymore because we did that 10 years ago, and look, it didn't deliver enough. And I think it's an issue where we have to set up the right expectations and the right deliverables. Otherwise, we just jump from one latest hot topic to the next without actually advancing and creating solutions.
You offered a critique of the grant process, the federal grant process. Why don't you go over that? And
there's a couple things that have happened, and these, we're actually putting these two at risk in the sense that if they should head down the, if they continue to have bad judgment and continue to be interested in science, they could get highly trained. Their parents could spend a lot of money sending them to elite institutions, and they could be in a situation when they're 35 or 40 years old where it's very difficult to get a grant to get a lab started and to get going. So we have a problem there in the sense that the basic federal funding of both biomedical research and even basic science through the National Science Foundation is under tremendous pressure because of the budget wars and the gridlock in Congress. I think we have another problem is that we've been at some level a victim of our own hype, and people expect to see an immediate return on investment. like Michael said, you know, we're going to sequence the genome, learn everything there is to know about every disease, come up with easy solutions for them, when in fact it's only raised more questions. And if you look at what happens, if you look at the history of how diseases have been cured, two of the most effective drugs discovered in the last 10 or 20 years work for the wrong disease. Viagra started off as a chest pain drug for people with traditional kind of angina, and VEGF inhibitors, which are terrific for macular degeneration, started off as anti-cancer drugs, where they've had some success, but it's been more limited than people anticipated. So there's a tremendous amount of serendipity here, and we need to have curious thinkers like those two kids. And we need to be able to provide those individuals a bit of a Montessori school for adults. And it's very difficult to do if you're worried about funding, if you can't get funding, if you get stalled out at the end of this prolonged period of intellectual adolescence at age 35 and can't get funded and so forth. And if you're doing, like Mike said, playing this sort of grantsmanship game constantly as opposed to focusing on what's interesting.
Hermanth?
Well, you know how you were saying that that we're advancing to like we should be more on the genetic side of like this research. Well, I think that it's better just to combine this stuff rather than just jumping to the because genetics, it's starting. You know, everyone is thinking like technology is the next part of like treating people, but it really should be a combined force of both technology and genetics, like genetically modifying cells and putting in these different sort of technologies so they can become more
and John, that's a perfect point and a great example of the problem that we have with grantsmanship. So somebody sends in a nice integrated grant that pulls in solutions from 4 or 5 different angles like these young people have. And the first thing that would happen when the grant got to Bethesda at the National Institutes of Health or someplace else in the Washington area, maybe the National Science Foundation, is the nanotechnology people would say, we don't want to look at this, let's send it to the genetic engineering people. The genetic engineering people would say, maybe this is better for the nanotechnology people. Then somebody else would say, shouldn't it go to the autism people? The autism people would say, there's too much technology in this. So you get people that try to integrate things and bring in solutions from all sorts of different angles, and sometimes it's difficult to do because we've stovepiped so much expertise.
And American Idol would look at you two guys and say, let's just fund the hot, young, new kids, right? As opposed to focusing on what the idea is. It's like either star-driven or it's boxed up into tiny little fragments. What scares you most about, or let me put it this way. Let's make it a positive question. What would you advise the president about federal support of science, knowing that the answers that are delivered today are going to be what you're going to be able to do when you graduate from college in the next couple of hours, when you graduate from college? Yeah.
Well, I just say that you should fund any genetic stuff along with technology, because for me, not for everybody, I think that's the most important treatments and scientific breakthroughs that will be made in the near future. Maybe a transporter, a hologram. Yeah.
I'm there, totally, yeah. What scientists do you admire, Joy?
Well, being from a partially German family, I mostly admire Albert Einstein.
Okay, great. How about you?
Well, I think I like all sorts of scientists, like Einstein or any sort of scientist that helps in science, because I think they're interesting.
Are your parents scientists in both of your families?
Well, no.
How about you, Hermanth?
Do you count a doctor as a scientist? Yes.
We could, in this room, we could probably say a doctor, scientist. Do they have worries about federal support for research and government support and programs that will be available for their work down the road?
Well, not exactly, but in the future, this more as federal, the government isn't funding enough to education, so for us down the road, there'll be less scientists or less innovative thinkers because some people won't get the education they would need.
People will start throwing things at me, but have you thought about college at all?
I want to go to MIT.
What?
I want to go to MIT.
You've thought about it, yes. How about you, Joy?
Well, my brother is actually leaving for college in maybe about a year or so, and he's been looking at a couple of colleges, and I've actually been maybe thinking about that a little bit, and he's mostly looking at this college in the city is called Bethel, and I thought, I've heard a lot about Bethel from, what my parents and my brother have seen of it, and I thought, hey, I think Bethel would be a pretty good college to go to. Either that, or I could also go to like Northwestern or Crossroads or Crown or something.
Or even stay in Minnesota. They do have reasonable schools in this state even. Well, I can't imagine you wouldn't be highly recruited based on this work and your next project. Let's talk a little bit about the next generation of researchers from the perspective that you see. You all have postdocs, I suspect, working in your labs who've come from different generation, different environment, different outlook about science. Lynn?
The funding, not to beat on this too terribly much, but it has had an effect on people's decisions. If you're a physician, to go into a practice mode, taking care of patients, which we must have, versus putting your career into more of an uncertain path if you're going to pursue an academic career and fight for grants. And there are fewer young doctors putting their stake on the research side because of what's going on. So that does concern me.
What's the riskiest thing you've ever done in research, Dr. Ackerman, in terms of staking out a position that you had no idea if you could either get a grant or would be productive? And how important is risk of making a mistake to your work?
Yeah, so as a physician scientist, we do mostly genetics of sudden death, and probably our riskiest grant that we wrote initially 13 years ago was to look for the genetic basis of infant death. Obviously, there's always the concern back then that infant death was always and solely due to environmental factors, bed sleeping on your stomach, make sure you put the baby on the back, and so forth and so on. Well, we wanted to determine what subset of SIDS was due to genetic heart disease, and because it had to be out there. But that was a risky move because it was against the expectation out there that SIDS was exclusively environmental. And back then, when we got that grant, just to talk about that, the funding rate for that first grant was 24 percentile, meaning we had to be better than 75% of the competitors. And most of us who are competitive people would say, if I can't beat 75% of the competition, maybe I'm not dialed in quite right. And I should be able to beat 75%. Now in the latest renewal, which we've had that grant going on that, what then was a risky question until the truth was emerged that showed that indeed some of infant death is a genetic disease, and have recently got it renewed, we needed to get it renewed in a 10% climate. So now we had to be better than 90%. And all the people who are left, because they're staying in the game, they're actually pretty good at their game. And so to now be better than 90% is just simply not sustainable. And so it was risky then, maybe risky now, and I think what concerns me the most about this is it simply isn't sustainable. And the young of today are seeing that it's not sustainable, so they're already early in the game pulling out of the game, not even going down that pathway or letting that investigative pathway start, because the work-life balance of being a day-in, day-out patient-seeing physician with the current work-hour rules of 60 hours a week, many of us who are current physicians who trained in that, I was just talking to a colleague, a 60-hour week would be viewed as unheard of.
Day at the beach.
Unheard of. And so now they're faced with a more predictable, balanced lifestyle with less risk, or choose to go down the investigative pathway to discover the solutions of tomorrow, and you too have a 90% chance of being unemployed. And so, or being defunded or not being funded. And we're going to have to figure out the solution to that. Otherwise, the whole research engine of America, at least in biomedical research, stops. And so one solution is get the government, convince the government to invest. I'm not a big fan of that solution because I have very little confidence in the government, but that's another topic. I think the solutions will have to come from the philanthropic community. There's billions and billions being invested in philanthropic pursuits, and we just need to make the cases why these various diseases have solutions that with an intentional focus on, we could get there. With that kind of focus and passion that these guys have, if there was intentional backing to get there, it'll get there, and it'll probably get there faster than the government. You know, just look at the Human Genome Project. The private sector version of the Human Genome Project was done ahead of schedule and under budget. The national version of the government-funded version of the Human Genome Project took longer and cost more. So I think we're going to have to look for solutions besides get more government funding into research to increase the percentile scores. It'd be great if we could get the percentile bumped up, because we're seeing a depletion of those investigative minds.
All right, a couple minutes before we go, I want to go around the horn here. Of course, you can add any other thoughts that you have. But what I'd really love to know from all of you is, and in each case, you've chosen to research something where a perfectly credible analysis might have been, in the case of sudden death, hey, it's just one of those things that happens. You know, there's not necessarily going to be a cause. Or in the case of huge numbers of breast cancer that aren't very specifically determined by risk factors, you know what? It's just one of those things. You're not going to get to the bottom of it. I think in the case of athletes, hey, they're just, they come along once every 100 years. And in the case of autism, you know, we're never gonna be able to cure autism. It's too complicated. The brain's too complicated. What is it that causes you to say, no, I think I can get to the bottom of it? Hermanth, why don't you begin?
Well, first thing, it kind of, when you think of it at, like, specifically when you've done, like, you have very high degrees of research in autism, you've done so much research, you know every bit and little fact about it, but just think of it, if you think of it as the whole picture of it, it's a little simpler to, like, visualize cures for it rather than, like, specifically, oh, this is like the specific gene that causes autism or something like that. So
the more you know about the brain, the more it tells you about where to go.
You just have to think of it, well, like maybe with an open mind or a wider view than specifics, because this cure was, this potential cure is not like specific for autism. It's more like it's the wide entire disorders, and it's like made for autism. It's not made for like changing this gene back or something like that, which is like not as
gives us a new tool in the toolbox. Joy, what do you think?
Well, I had something I was going to say. I don't remember what it was.
We'll come back to you.
Okay.
You want to be the wind-up in this act.
Okay.
We'll give you the last word.
Okay.
So,
for me, it's easy. I love taking care of patients with these genetic heart rhythm and heart muscle conditions. And so because of that, my career is devoted to preventing their sudden death, and more importantly than that, to help them to live and thrive despite the diagnosis, so that they don't see these as death sentences. But, and with that focus and commitment to these patients, our lab and our research program just wants to get smarter about their conditions and make steady advances. Ultimately, I'd love to say we will cure long QT syndrome. So that's obviously the goal, but we have the eye on the prize, and it starts with a commitment to the patients with these conditions that excite me.
Dr. Hartmann?
I'd say two factors. I've had the privilege of being in the room with a lot of cancer patients over the years, and there's nothing more motivating in that and wanting to be a part, wanting them to have other options than they have today. And I've never been a accept the status quo person.
Dr. Joyner.
Yeah, and to pick up on the accept the status quo element of what Lynn said, I think, you know, for all of us, intellectual pursuits kind of remind us of the old Irish saying, is this a private fight or can anybody join?
And Joy, you want to take us out?
I remembered what I was going to say.
All right.
Okay. So, with a few little updates, there could be very minor, but with a few updates, we could potentially find the right technology to do what we hope can be done for autistic people. And also, this was supposed to be a very futuristic idea for the contest, because we were supposed to envision what exactly do we want to happen 20 years from now to help whatever we think we can help. And we thought of autism because we have a lot of autistic kids at our school.
Well, I would have to say thank you so much for agreeing to think down the road 20 years. And thanks to all of our scientists up here. Thanks so much. All right, that's the end of Science Sunday.